Hello, Kaylee Summers. You are back. I am so happy that you said yes to come again.
Yes. Oh my
I
gosh, I'm so happy to be here. Of course I said yes.
You were the first person that I interviewed for the podcast. And as I've shared with you offline, the responses have been outstanding. And just people are so appreciative of what you offer and what you've given us as a gift, really kind of walking into this world, knowing that we're going to meet people who've had similar life changing or life altering experiences. And you gave us a bird's eye view and some really powerful insight into what people experience. And so, I think that what we're going to do today is take it in a little bit of a different direction. I've wanted to do this for a while. We're going to do something that I'm going to call a therapist edition.
Love
And
it.
right, so that I think that you and I have said we look into birth trauma trainings and there's really limited stuff out there. A lot of birth trauma stuff that's out there for therapists really actually relates to being a survivor of child sexual abuse and
Yep.
working with those individuals. Like some of the best recommended books out there are ones for when the birthing mother is a survivor of child sexual abuse. These are the things you want to consider. But in
Yes.
terms of supporting a person after birth trauma, there are chapters in books, but they're not there's not a ton out there. There are books, but there aren't a lot out there. There's not a lot out there that really targets the skills that are needed and the understanding of like what's happening to a person. And then I also really want to expand that out, relating to the family, the extended family, the relationship, parent and child. Let's see how much we can cover today. But
Yes.
our target audience is therapists. If you are not a therapist, but you want to learn and listen, we welcome you into this room because it
Yes.
makes us all just smarter, right? Are we on the same?
Absolutely.
Okay, good.
Yeah. And like the psychoeducation, right, is such a big part of, at least in my work. It's a really healing part of the work, is that front end psychoeducation around trauma and perinatal trauma and what it means and what it feels like and looks like and what's happening in your brain. All of that
Yes.
stuff is so important even for non-therapists.
Absolutely, absolutely. Because I think we will in our lifetime meet someone who's had something. And I think this gives us some of the wording that's needed and a deeper understanding. Okay. So for anybody who has not listened to episode number one, I really encourage you to pause here, go back to episode number one, learn the story of Kaylee and her experience as a trauma survivor. For all of you who just don't have time to do that right this minute, in one sentence or less, Kaylee, tell us who you are. First, also introduce yourself as the therapist that you are and the expert.
Sure, yes. Okay, so my name is Kaylee Summers. I am a licensed clinical social worker. I do specialize in perinatal trauma. I own a practice in Downingtown, Pennsylvania called Holding Hope Perinatal, which also specializes in specifically perinatal trauma. Um, and I got into this line of work. I was already a therapist, but then I had my own perinatal trauma experience of surviving an amniotic fluid embolism. And the short version of that is I survived, and I thought that that would be the end of the story. And it was really quite literally just the beginning, and just the emotional turmoil that followed from surviving a birth trauma. And that's really what I've dedicated now my life to, advocating for, supporting, etc.
Okay. So when I think about being a therapist and someone walks into my room and she says, "Look, I almost died," right? I had what we call a near miss experience. There was an almost maternal fatality and thank God I'm so lucky. I'm so grateful. I'm so thankful, right? That tends to be the lines, right? Or
Uh-huh.
their family is saying, "We're so lucky, we're so grateful, we're so thankful." Why don't and your comment I underlined it in my notes was why don't I feel okay? Like why am I not okay? Like I'm thankful, I'm grateful, I'm alive, I survived, my baby survived, but I'm not okay.
Yep.
Talk me through from the survivor experience. What is happening in the brain between but you survived, but you're okay to but I'm not okay.
Yeah. The way that I like to lay this out for people is that this really terrible, awful thing happened. And because this really awful, terrible thing happened that you didn't expect, that shouldn't have happened, it's just kind of a really bad luck, um, in some cases, you now are expected to be like the most grateful. Like, you of all people are expected to have even more gratitude because you survived something that was terrible and awful and never should have happened. that equation doesn't make sense, right? Like, you can, and we talk a lot about conflicting emotions and how you can feel two things at the same time. And really, the human experience, we are rarely feeling one singular emotion at a time.
Sure.
And so, in this case specifically, we can feel grateful, right? A lot of us who have experienced a near miss, I I cannot explain to you the way it changes your life, in that I just went to my 4-year-old's first holiday sing in pre-K and couldn't not be teary, because every one of those moments that we have as someone who experienced near death is like, I can't believe I get to be here. But that is mixed with the fact that we had a really traumatic experience of birth. And for a lot of us, especially in that near miss community, it's the only birth experience we'll ever have if it was our first. And so, yes, I think a lot of people will say it could have been worse, right? I mean, anything could always be worse.
Sure.
It also could have been like so much better.
Agree.
And the piece that I use, especially because when I get people who come in, to, if I switch hats a little bit, when I have people who come into my office and say, like, it could have been worse, or I don't even really know if I'm going to consider it trauma because of X, Y, and Z. My favorite metaphor, and I don't know if I said this in part one, so if I did and I'm repeating myself, I
It's
apologize.
okay.
But in case people didn't listen to part one and it's not there, my favorite metaphor for this is that if trauma is your house on fire, right, which I think is a great metaphor, it feels like your brain is
Sure.
on fire, your house is on fire. When your house is on fire, you don't go walk out your front door and look down your street to see whose houses are on fire worse than yours before you get help. You either put out your fire or you call someone to help you put out your fire immediately. And that's really how I view this comparison game of trauma. There will be other houses on fire. We know 1 in 3 individuals perceive their birth as traumatic. There are unfortunately millions of fires happening. And that doesn't take away from the fact that you have to take care of your fire or your whole house will burn down.
I think one of the things that I think about, and no, you did not use that metaphor in the first go round, so it
Okay,
was good to use it here. I
good.
think one of the things that I think providers, especially, let's say, I'm gonna define a provider.
Yep.
Medical providers really struggle with the idea of having traumatic implications or emotionally traumatic experience for the survivor, when it feels almost like there's a blame game that can happen. Like, my physician did not provide the best care, the safest care, or this happened under their watch. And therefore, it feels like if I, as a patient, express distress over what happened or a trauma, the provider like almost could take it personally. And so I think there's a little bit of like protectiveness that kicks into gear of like, no, but you survived. No, but you made it through. No, but the outcome was good. Like, we saved your life. Why we're good now. Right. And talk about like what that one of the things you had said in the podcast was this idea of like, my story was not my provider's story and
Yep.
their story was different. Can you break that down for me?
Yeah. So, in breaking it down logistically, my providers were there with a healthy pregnant person, and I went into cardiac arrest with no warning. And so they had to work very quickly to, in 6 minutes, get my child out, resuscitate me, all this. My hospital had never seen an amniotic fluid embolism before. So this is their first time ever dealing with a complication that has a very high mortality rate. And the many stories that I've heard from the OR that day is that there were many points where it was like, this mom is not going to survive. We have done everything that we can do. We're going to keep doing everything that we can do. But if you're a medical professional who's listening, like when I show people my arterial blood gases, and I have shared that before publicly, they're like, you should be dead. Like, I was dead and they literally resuscitated me. And so being a provider in that room where you knew that I was going to die, and for some uncertain reason, I didn't, through lots of interventions, of course, but also like a little bit of luck. That experience is traumatic, but it's also like so rewarding, because all of the skill sets that you have learned, all of the interventions, all of the choices that you made that day, you had to make perfectly so that I could be here to be a mom to my son. And there is something beautiful in that. But my experience was that I walked into the hospital healthy, totally fine. And I woke up 7 days later being told that I had died, had been on ECMO, was ventilated, didn't have a uterus, couldn't have any more kids, et cetera, et cetera, et cetera. Missed the birth of my son, like all of the things. And so those are just two totally different experiences. Now, the thing that is very different in my case, and I talk about this a lot because I really want people to understand, my situation is a very unique one. And so my team was just as traumatized as me, but in a very different way. But there's something very connecting about that, as opposed to a provider who sees something that might be quote unquote run of the mill to them and is very traumatizing to their patient. And now we have a huge mismatch. And so we have patients going into providers and saying at their 6-week appointment, "Oh my God, this was so traumatizing," or, whatever they're saying, communicating to their provider. And their provider is like, "Well, what do you mean? This is what we always do. Like, how are you traumatized by that?" Or something very dismissive of the sort, because they quite literally can't understand from their perspective how this was traumatizing, because they don't understand trauma,
And I think
psychological
that
trauma.
and probably try to convince you that it wasn't as bad as you think it was, right? Like, there's
100%.
a definitely a bit of like, "No, but this was really difficult for me," but for the physicians going, "But we deal with this all the time, and the outcome was good. We did exactly it worked exactly like we were supposed to make it work." And so therefore, there's that disconnect of like, "Yeah, but you're not hearing what I'm telling you. I'm telling you that this is holding something. There's a hold on me that I didn't anticipate."
Yes. And as a patient, like a patient can't get to that point, in my opinion. Like, when you are dismissed and invalidated and gaslit in that way, it's very difficult to come back and be like, "But hey, listen, you're not listening to me," because you shut down.
Sure.
And I often talk about, for a lot of people, the consistent invalidation of their traumatic birth is sometimes more traumatizing
Mm,
than the event itself.
mhm,
The
mhm.
amount of people that come back and are like, "But that shouldn't have been traumatizing," or "That wasn't a big deal," or "At least you survived, at least you and the baby are alive." That constant invalidation, in my opinion, can be more traumatizing for survivors even than the event itself.
And I find that so powerful because I definitely don't think there's much training on that in the medical milieu at all. I do want to acknowledge here just also this that the experience and the exposure to a significant traumatic event with the medical team and the medical providers. Like you said, they were not prepped for this. This is the first time they've ever seen this. This came out of nowhere.
Yep.
And I think about you described in the first telling of the story, you described how the physician came out, your OB came out covered in your blood. And you said, I mean, it made sense. She was trying to save my life. But what was that like for your husband, your mother, to see your parents were both there, to see that exposure? And then also what it was like for the physician and the nurses staff. And I like to also acknowledge, what about the cleaning crew, right? The
Mhm.
cleaning crew that has to come in the aftermath of a traumatic bleeding event like this, and there's nobody's talking about this. There, the typical debriefing is, "You good? You good? You okay?" Like, "Everybody go back to work now."
Mhm.
Talk to me a little bit about what you imagine or what you know to be the exposure for the medical team when there is a very complex traumatic outcome.
Yes. So I'll start with the medical team and then I can talk about my family a little bit. But so we know that secondary, second victim, however we want to label it, trauma, happens often with medical providers, and they are told to just kind of like, "Okay, go
Go back
along.
to
This is
work.
part. This is part of the job."
Right.
And we know that that has a trickle down effect to patients. If you are traumatized as a provider, it is very difficult to provide trauma informed care. And so that's like a whole nother conversation for another day. But in my specific case, I do think, again, it's a very extreme case. So I think things were handled pretty well for my team. My understanding is that there were two debriefs. One was the medical debrief. So everyone got in a room and talked through the case and what was done. And then there was a like, I don't know how they, like, an emotional debrief basically.
Mhm.
So I delivered at, like, it's a trauma 2 hospital. I believe it's still like labeled as a community hospital, which means like it's not a teaching hospital, it's not a huge big medical center. And so when my AFE happened, it was a hospital-wide event.
Mm.
So I have people to this day who will text me, or not text me, but like message me on social media and say, I was a nurse on med surge that day. I'll never forget when that code went off. Or I was on the trauma floor and that was someone said that was a dark day for trauma. I will never forget that. And so they had everyone involved. We had techs, we had interns holding doors. We had like it was a full hospital operation. My OB practice, most of the OBs from my practice were in the OR. So then the other OB practice had to cover all of the patients on the floor, not just theirs. So there are a lot of these little pieces of the puzzle that unfortunately I feel like a lot of people experienced either trauma or grief related to that experience. And I think, I had a nurse, I was just back there for Cal's birthday in the summer to bring them like cookies. And a nurse was like, oh, this just popped up on my time hop. And it was a picture of her um, Apple Watch because she was a blood runner. And so her heart rate for like the full from like 12:30 to 2:30 was like up here because she was running up and down the stairs with coolers of blood for me.
Whoa. Whoa.
Yeah.
Wait, I just need to ask you one question.
Yeah.
What was that like for you to see that photo? Because I just think about the like all of a sudden the room just shifted into a different angle that you would never have known about if technology and social media, et cetera, were not what they are today. What was that like for you to see that?
So it is validating on a level that is hard to describe for me.
Okay.
But this is related to my personality. I know not everyone will feel this way, but I am an information gatherer. And this was a really hard part of my trauma in the beginning. I missed 10 days of my life. The most traumatic, most important 10 days of my life I wasn't there for. And I had this really deep connection. I was just talking about this on Instagram last week with my medical team. I was obsessive about finding out all of these little angles,
Mm.
finding out exactly what everyone was doing at that time because I wasn't there. And there are so many. I had a patient, like, this is the craziness of social media. I had a patient reach out to me and say, I gave birth that day at Paoli. I was in, I had delivered, I was in the postpartum unit, and I will never forget the code going off, everyone running, and my nurses weren't allowed to tell me anything, but they did say the baby was safe.
Whoa.
So it was just like, I feel so bad for the mothers that were on the unit that day because they heard a code blue for maternity. Then they weren't allowed to leave their rooms. Like usually you're allowed to like roam the
Sure.
hallway
Sure.
and like
Sure.
walk and everyone had to stay in their room for the entirety of that day.
Whoa.
And they knew something bad had happened and they didn't weren't allowed to be given any information technically.
And so then I think about, a client comes into my room and says to me, I was one of those moms. And as a therapist, I have to be careful not to think like, yeah, but you weren't the mom who was just had an embolus. Like you weren't that mom. Why is this impacting you so deeply? And I think that like just kind of pinning that reminder that exposure to
Yes.
trauma has so many layers. The woman who is the blood runner up and down the stairs. And I wonder what it's like for her to be reminded on her time hop photo. Oh,
Yeah.
this happened to you a year ago. So that even if she said, no, I'm okay, I'm okay, I'm okay. But I imagine, and I can imagine that seeing that picture brings you right back to that moment in time. And
Absolutely.
for you is one thing, and for her can be incredibly unexpected. And
Yeah.
we talk about trauma as this large picture experience of many different facets, but I think when we highlight the little list of the pieces of it that are not so little, we are reminded as therapists, like, listen for that thread within the story, the
Yep.
things that keep bringing them back, the things that are the constant reminders. I think it's one of the most frightening algorithms of Facebook. And I imagine Instagram is the same way. I'm not as exposed to it in that way, but like that 1 year ago, you were doing this. And
Yep.
that could be an exposure to a child that died or a pregnant belly that you're no longer pregnant. And there's so many, we have almost there. I believe there are some ways to shut some of that off from an algorithm perspective, but in
But
general,
still. Yeah.
it's still showing up there. And so that constancy of reminders, Whoa. Okay. That's pretty powerful. That's pretty powerful. And
Yeah.
do you see that some people are who are survivors of trauma, this kind of specific birth trauma, are not information gatherers and they deal with their experience differently? What has your experience been with them?
Yeah, definitely. Because I think everyone has their own way of dealing. But I think some people are it's too much. It's
Mhm.
too overwhelming to consider what happened to them in those moments. And I think that is completely valid as well. I think it's my obsession with finding information always overpowered how triggering it was for me, meaning that like I would look through my medical records obsessively and it would like put me in a funk, but I wouldn't care because I needed so badly to have that information. And so no, it was not like healthy, like helpful in a lot of ways when I would be like up until midnight, right? Like looking at my records or whatever it was. But I couldn't really help that. Like I needed more information. And then every time I would get another story like this from like someone who was in the hospital, there was someone else who was like diverted, like people, they weren't taking maternity patients unless you were actually in labor. They had to divert because of what was happening with me. And so like someone told me that story. Um, and so it was almost like I wanted all of the stories, and I finally eventually had to accept I will never know all of the angles of my story that day. I will never know how many people knew what was happening. I will never know every single person's role in saving my life because there were like more than 100 people. But it was so important for me to connect with my team and learn these stories, to truly validate what I had experienced, because you always start to question yourself.
Right.
Um, and so I do want to put a plug in here and again say, like, I'm really privileged to have a team who supported that, because I would say, I don't want to say most people, but I know a lot of people who don't.
Right.
And it has to do with like the uniqueness of the rarity of an AFE, like the team just being amazing in their way. But like there are a lot of pieces here that have validated my experience from the get, that have allowed me to heal, I think, more quickly. It doesn't mean my trauma is less, or anyone who's experienced a similar trauma to me is less. I'm not saying that, but there is something about everyone being on your side
Yeah.
saying this was traumatic. We're all
Yeah,
traumatized
and
too.
not holding back information. I think when you talk about the
Yes.
fact that your doctors and anesthesiologist, showed up at your other hospital to see you and ultimately were the ones who were responsible to tell you the story or who chose to be the ones to tell you what exactly happened. And I think about how many of the women I work with or I've spoken to who have said, well, should I talk to my doctor? Should I ask them about what happened? And not feeling quite confident that they're going to get what they need.
Yep.
And I think there's always that threat also of liability, right?
Oh,
Are our
yes.
physicians and medical providers comfortable with and confident in their stories and what happened? Or are they so unfortunately overloaded with malpractice concerns and liability concerns that it prevents them from being human?
Yeah.
Yeah.
We see that a lot, unfortunately.
Right?
Yeah.
So one thing I'm curious again as as a therapist, if I have a patient who a client who is saying to me, I spend hours and hours doing reviewing my medical records versus a patient client who says, I don't even want to ask, I don't want to know, I cannot go there. Talk to me as a therapist, what's your approach, right? How do you
Yeah.
differentiate between you just said, well, I don't know if it was healthy, but and I'm thinking, I don't know that it wasn't healthy if that's what you needed.
It had to happen, right? That's how I always feel, is like, was it always the best for me in that moment? No, but it was, I am a bulldozer. There was no way it was not going to happen. And so exactly that. I think we meet our clients where they're at, and wherever they are, as long as they are, again, safe. We are like getting curious with them. We're getting curious about what it means to be able to read through those medical records. We're getting curious about what it means to put up that boundary and how that serves them and how that helps them. So that, again, that compassionate curiosity is always where I go with clients, regardless of how they're showing up with their trauma.
I think that's such an important reminder that there isn't a right necessarily or a wrong way to do this in the aftermath of a traumatic event. Okay.
Absolutely not. Yeah.
All right, let's talk about your family because they were
Yeah.
there. They were actually
Yes.
there. And I'd love if you
Yes.
divided it out a little bit between your husband and your
Mhm.
parents and your best friend who was there as well.
Yeah. So my poor husband. He was, yeah, he was there. So when I it went into cardiac arrest, so I started screaming that something was wrong with my heart. And my nurse turned to look at my vitals. My husband actually ran out into the hall and screamed for a doctor. And I recently went back, like I said, it was the first time I'd actually been back to Paoli since right after he was born. So it had been a few years. And so I actually walked on the L&D unit and they showed me my room, which I had never seen, and took me through all that. And so they showed where how they could hear him so clearly because we were right across from the nurses station. And so he shouted for a doctor. And as he did that, I think my nurse hit the rapid response first, and then like 10 seconds later hit the code blue. And so, yes, my husband unfortunately saw all of that. He remembers them calling out for OR1. OR1 is booked. OR2, do we have a pulse? He doesn't remember, thankfully, what they responded to that. I'm guessing probably a nice little trauma response for him. Um, and so I was out of my room within a minute. And he does have like interesting memories of being like pushed into the back corner. And he remembers like, it's not funny, but it's so interesting what our brain does. He's like, I remember being like, oh, I got to get the suitcases out of their way. I had a long induction, so we were there for a while. He's like, I got to get these suitcases out of their way. And they're like, just move. Like, you just get out of the way. Um, and so, yeah, so again, I was out to the OR and a nurse manager and maybe another nurse came in to talk to my husband because he was in the room by himself. And no one knew what was happening at that point. They couldn't really tell him anything. They were just like sitting with him. And then um, I can kind of jump to my parents because they're involved in this part. They were in the waiting room. We had just apparently, I don't remember any of this, told my mom we wanted her in the room with us for the actual birth. My husband was spent after 2 days. He's like, I need another support person in here. My mom and I are very close. And so it's kind of sad to think about because she was so excited. And she actually went to the waiting room to tell my dad, I'm going to be in on the birth. And when she was in the waiting room, they heard someone call for a doctor. And they're like, that sounds like Steve's voice. And my mom's like, no, I don't think it was Steve's voice. Then they heard a rapid for maternity room 220. And they were like, wait a second, that's Kaylee's room. But we don't know what a rapid means. We don't know. And then they heard code blue. And my mom, where the waiting room is, my mom tried to get back to my room because it's kind of like right around the corner, but there was actually a critical care conference or like meeting with the critical care providers on the L&D floor. And so what happened is the code got called and everyone from that room started sprinting to L&D. So they were all passing the waiting room. And my mom tried to get out and they kind of were like, no, you need to like go back in. And she was like, you don't understand, it's my daughter's room. And they were like, you can't go back there. And so eventually they let her back to Steve, and she just remembers Steve kind of pacing the room with his hands on his head, saying like, please just save my wife. And so they then were there. My dad was in the waiting room still. It was like the worst timing because I was 10 centimeters. So we had told everyone to come. And so he was waiting for my brother and his wife to show up to tell them that just like something not great had happened. Instead, my best friend showed up and she walked into the waiting room and saw my dad sitting in the corner crying with someone next to him that she didn't know, which was the chaplain at the time. And so she went up and was like, what the hell is going on? And he's like, we don't know. It's really bad, but we don't know. We don't know if it's Kaylee. We don't know if it's the baby. We don't know if it's both. And so then he went back to the room and Jesse, my best friend, waited for my brother. Same exact cycle happened. Crying, we don't know what's happening. And then my brother and his wife went back to the room. Unfortunately, because my best friend isn't family, she had to stay in the waiting room.
Hmm.
which is awful. But she called, or her husband now was with her, thankfully, and they called her mom to come and sit with them too. And so that was tough because where they run blood is right past the waiting room. And the waiting room is clear glass. So she just saw people running coolers and coolers of blood past the waiting room. And then they called the first time was probably like maybe 20 to 30 minutes into the code. So my son had been born at this point. My OB came to the chaplain and the social worker came to the room to get my husband, and they had to bring him to a room that was closer. I think I may have described this, but he felt like when he was walking, they were walking him to a room to tell him that I had died. Because again, he had a chaplain and a social worker on either side of him. But that's when my OB came in. They were just trying to get him closer to the OR,
Right.
and covered in blood. And she basically said, the baby's fine. But Kaylee had an amniotic fluid embolism. We're doing everything we can to save her life. Then they updated my family again, probably another hour later, which was not good. It was that we can't stop the bleeding, and we don't know what else to do. So we need you to pray.
Yeah.
Yeah.
Mm.
And so that was, yeah.
In hearing this, I think about the different facets of the experience. Yours is one story, and then, of course, your husband and the threat of losing you, and of course, the baby as well. And then I think about each circle out, right? Parents, even the inner circle, the second circle, the third circle, your best friend, your brother, everybody was right there. Like
Yeah.
the hour by hour, the minute by minute and hour by hour exposure is
Yep.
is very raw and very real. And I'm wondering, what do you know of what their aftermath was? Did it change things even in your relationship with them?
Significantly, in a lot of cases. So when I think I was still in the ICU when I said this. I was like, "You're getting therapy. You're getting therapy. It was like Oprah. You're getting
Uh-huh.
therapy. Everyone's getting therapy." Um,
You already
and
caregiving.
yes, I was like, "You're all getting therapy."
Hmm.
But yeah, so it changed a lot of things. I am a youngest child, and I very much like fit that role. I don't know if people know kind of youngish child tropes. I would say I am. I still call my mom like every day, twice a day, like how to cook something, how to do laundry, like that is me.
Got it.
I feel like that sets the scene well. And so but I'm a very independent person. And so that really changed when I woke up in the ICU, and I was terrified. Um, I was very anxious. My husband warned my trauma doctor that when they brought me out of sedation and extubated me, that I'd be very anxious. And I'm rolling my eyes because I just feel like who wouldn't be anxious? Like
Right.
who would wake up from this incident having no idea they had a baby and in a CT ICU and wouldn't be anxious? But anyway, the trauma doctor said to my husband, like, wow, you said she'd be anxious, but I didn't know she'd be that anxious. And I'm like, friends,
Right.
friends, how, anyway.
Right.
So I
Hmm.
was highly anxious and I couldn't, so my mom and husband had to trade off nights sleeping in the ICU with me once I woke up. Steve had been sleeping there every night when I was still on ECMO. And then me and my family convinced him that he needed to go to the hotel certain nights and sleep, and my mom would sleep with me. And they kind of traded off in that way. But the relationship, the hardest part, I think, as a whole kind of unit, was that I very quickly reverted to being a daughter. I wanted no parts of like being independent, being a mom. Like I wanted to be taken care of. And my husband's expectation of having a child together was that we were starting our family on our own. And that created a ton of conflict. Because in order for us to be able to take care of our child, I was discharged straight from the ICU after 2 weeks. And so I couldn't do anything. My parents had to live with us for 6 weeks. And so it became like my husband was like, what is this? Like I thought this was our family. And now we adore my parents. Like, I'm
Sure.
very close to them. Steve adores them, but it was a very dark time. Um, Again, my parents thought that their daughter died. Like, they thought they lost me. And so they're dealing with that trauma still. And they're dealing with the trauma of watching me kind of be a shell of myself.
Mhm.
I didn't care to interact with my son. I didn't really care to do anything because I was still in so much physical and emotional distress. And so that caused a lot of anxiety, I think, in my family.
Mhm.
Um, and so, yeah, there was a lot of conflict because my role shift wasn't in the direction that anyone assumed that it would have been.
Mhm. When you
Um,
think about Steve, like what were some of the symptoms that you saw, if you call them symptoms, or what was presenting, right? Things were not okay. Yes. And now what were some of the symptoms? Was there rage? Was there anger, irritability? Like, what are we seeing in him? He's not necessarily going around crying, but
uh-uh.
what was the experience for him
Yeah, and
physically?
so a very typical male experience to trauma, which was like irritability, anger, frustration. Like, I think a lot of the conflict within my family too was this like irritability and anger. And I was like, why aren't you just grateful? They're helping us so much. Like, we would be lost without them. And he was having the experience of, this is nothing like what I expected. And he was definitely had more of that sort of like irritability and edginess, and he didn't think that he was traumatized.
Sure.
He thought that it was just like a really hard experience, but he did not. I have a podcast where I actually brought him on,
Mm.
and he talked about how he just didn't feel like trauma fit for this until he really got into it in therapy and things like that.
Mhm.
Maybe I said it enough times at him that he eventually accepted that he had been
Right.
traumatized.
And I think about like nobody's paying attention to him. Everybody's focused on
Mm-mm.
the patient, and the patient in the room and at home is you at all times. Yeah.
Yes. And I didn't help. Like, we become very appropriately, I think, a lot of people become self-centered in their trauma. Self-centered sounds very strong, but I'm saying this about myself. I did not care. I was like, I literally need you to just snap out of it because this happened to me in my body and it didn't happen to you, which is so not true, right? But my state was so like, I lost my ability to have kids. You didn't technically. Like, I lost all of this. This happened to my body. So I was just like laying it on thick,
Mhm.
because I think a lot of this happens in a lot of relationships, especially being a therapist. I'm like the emotional
Sure.
fixer of things.
Mhm.
And I am always doing the like, okay, let's think about this. Let me help you with this. Let me, you know. And I was like, for once in my life, I need to not be that person. And you're not letting me because you're traumatized, right? Like, this is absurd
Right.
to say it now, but it is 1000% how I felt. And I've worked through my guilt and shame around that. And I feel confident in being able to talk about it. But I was literally like, I need all the space. I need every inch of space right now. And you're taking that from me by having this conflict with my parents, by being traumatized. Like, stop. And that created I held on to so much resentment for so long because this didn't happen to him in my mind. And because of all of the sort of like conflict that happened and his own trauma coming up. Um, I felt like it was like I felt like a little kid stomping my foot. Like, this is unfair. I need to take up all the space and I need you to just like get it together.
It's very interesting because when I hear you describing this, I mean, definitely self absorbed is not the word I'm considering at all, nor the perspective, but I'm almost seeing it as like, when a body is under assault, even something like they're out in, given I'm trying to think of a good example, but let's say when a person is struggling with an eating disorder, this might be a very dramatic experience, like a dramatic example, but like you're struggling with an eating disorder and the body begins to try to conserve energy, right? It stops some of the higher level functioning and just kind of retreats into that very
Yes.
primitive state of survivorship. Like, to survive, we have to stop
Yes.
doing some of those things that are of external extremities. Like, the body, if you're cold, the body pulls the blood flow away from the extremities to warm the internal organs. When you
Yep.
describe that, it sounds to me like Your body was literally in that mode of, this is what I need to do to survive right now. And even though I am alive, survivorship feels very different in the aftermath of a trauma. Does that resonate with you? Does that
Oh
seem
my
to make
gosh,
sense?
yes.
Okay.
Totally. Yeah. And I think too, our world becomes so narrow
Yeah.
appropriately in that state of
Right.
survivorship. Like we it
Right.
has to become narrow. And I think that's why we see such difficulty. Again, this is all like appropriate normal reaction, but so much difficulty with kind of comparison and trauma,
Yeah.
because the trauma that happens to you will always be the worst trauma because it's the one that
Sure.
happened to you.
Right.
And so when we can't see outside of that, which we cannot in the beginning, it is quite literally not possible. We can't hold space for other people having different traumas.
Mhm. It's
And-
self-preservation more than
oh, absolutely.
self-absorption, right? You,
That's a
in
good
order,
point.
right? It's so self-preservation to me, then from a trauma-informed approach, is to say, once retreated, like once we preserve the internal organs, and then
Yep.
we will begin to, what does it take for you to then begin to expand again back into yourself or back into who
Yeah.
you are becoming now in the aftermath? What was that process for you? Beyond, besides, we all agree therapy, but what, if you were to describe that, like what would you say was what you needed in order to move back out into I kind of see it almost like as a balloon, like expanding, like going back to your edges.
Yeah, it's a great question. Yeah, we all know therapy. Um, that was definitely key for me, finding a therapist who like was just really, really good at what they did and like connected with me. Um, I do think that for me and for most trauma survivors, like that validation, that feeling like, of course you feel this way. Of course your world feels like it got turned upside down because it did. And that's a valid experience that you are having. Um, and again, I feel like there are a lot of privileges that I sit with in my recovery. And I think that there are a lot of layers for other people that make recovery really, really challenging and that they have to like dig in. And some examples of that again are kind of like it's easy to validate my story. It's easy to look at that story and be like, whoa, geez, of course you're traumatized, right?
Sure.
That comes with its advantages. I also think I have just like my family, my best friend, I talked about this experience for like the whole first year. That's like all I talked about. And my family let me, my best friend let me. I would literally be like, okay, but like what happened when you were here? Like what were you seeing? Like what was
Mm.
happening? I must have been so annoying. But whatever, like I need that's what I needed. And my family knew that, and my best friend knew that, and my husband mostly knew that, but he also had his, I mean, the poor guy. I'd be like, and so when I was dying, what were you thinking?
Right.
Like what was going
Right.
through your head?
Right.
And like what was
Right.
being said in the room? I was literally pressing like
Mhm.
every trauma button because that's how I
Yeah.
was healing. So
Yeah. Yeah.
not to belabor the point, but I had a lot of support in my corner. I was able to I had 12 weeks paid already with my job, and I went out on short term disability. So I had my son in July and I didn't return to work until January.
Mhm. Mhm.
I remember I was supposed to return in November, and I was like, I just got to know my son. I haven't spent any time with him in a like present capacity at all. That is a massive privilege for me to be able to have that much time and still be paid off.
Sure. Sure. So
Um,
I'm just in thinking about that relationship with your son. I know that you
mhm.
mentioned that it took a good few months for you to even begin to reconnect with it, or to begin the connection and to begin to parent him in the way that you would imagine that you would have liked to. Um, can you talk through a little bit about that process, and maybe even recommendations to therapists when you're hearing a client say, I just don't feel like I have the energy, the capacity, or like I just have not been able to connect with my child. What's our job in those spaces?
Yeah. So, first, I want to point out that what I see often as someone who works with a lot of perinatal trauma clients is that there are kind of two paths with bonding after trauma. My experience, which is like related to that hypoarousal that we see, that kind of numbed out, disconnected. And then there's the hyperarousal. And
Mhm.
so we see people who are overly bonded is not a good term. I don't like that. But that hyperarousal, that constant checking that no one else can take care of my baby. I have to be the one. I have to make sure they're okay because maybe their trauma is related to them almost not being okay.
You can call that
Or
anxiety, like from a very anxious space.
for
Would you
sure.
say? Or you wouldn't?
Yes. So I would. Because it is. That's the
Okay.
symptom. I
Okay.
like to I don't know. Sometimes I really like to separate out the term hyperarousal with anxiety because I feel like hyperarousal is related to the traumatic experience.
Okay.
And so it
Okay.
like helps clients be like, "Oh, I of course I feel this way because of
Got
the
it.
trauma." And also when we treat that trauma, we do see that hypervigilance come down.
Okay. Okay.
And so that's so again, is it clear to tease out those two always? No. There could absolutely be someone diagnosed with PPA who is struggling after trauma. They're kind of like I was diagnosed with postpartum depression and went on medication for that. But like, do I think that is massively a response to the trauma I went through? Yeah.
Sure.
But they're
Sure.
so intertwined, right?
Sure. Right.
So going back to the bonding piece, I think it is another piece where we have to meet clients where they are at. So when it comes, I think we can do, I like to approach treatment twofold, where we're doing some like logistical coping things on one side, and then we're really doing that psychoeducation and normalization of their experiences on the other. So like not bonding with your baby after traumatic birth is a normal reaction to an extraordinary experience.
Right.
You will bond with your baby. It may take more time. I also talk about how the expectation of bonding without trauma is absurd. Um,
Thank you for
like
saying that. I very much
newborns,
appreciate that.
newborns are like a sack of potatoes, is how I like to call
Yes.
them. They're beautiful, lovely, we love them, but they don't do anything. And we're just
Right.
expected to be like, oh my God. And for
Right.
people who feel that way, yes, I love that for you.
Right.
Um, a large majority of people, regardless of trauma, don't feel that. Bonding is an actual thing that like takes time and like almost
Yes.
for me, it
Yes.
took a little bit of practice actually.
Yeah.
And so what I do recommend are like some little things, getting curious, can I offer some things that I've heard from others that have helped, start to feel that connection a little bit more. It's not going to magically make you bond. That does take time, but here are some things that can help with that. And we talk about um getting out of the house, just you and your baby if you're able to, right? We have to take into account physical limitations in a lot of these cases, but
Sure.
spending time just the two of you, but like doing something outside of sitting in the house, which is what we're mostly doing postpartum. um I had a podcast with the wonderful Bethany Warren, who is you're smiling. Do you know Bethany? She's
No, but I
wonderful.
just love that everybody's like
She's
capturing your brilliance and sharing the wisdom out there. It's
she's
amazing.
well, she was actually on my podcast. She's wonderful.
Ah,
She
okay.
yeah, she's a reproductive trauma therapist out in California.
Okay.
And she talked a lot about how we also have to normalize the fact that like doing care tasks for your baby is actually, even if you feel like you are like, oh my God,
Mhm.
do the diaper and do the thing,
Right.
this, I feel
Right.
terrible. It is connecting you with your baby and
Yes.
they are bonding with you. There's a beautiful research article that talks about bonding, and it talks about our like angst and anxiety around bonding and thinking that our baby isn't bonding with us.
Mhm.
It is all actually perception.
Love it.
Like
I love
so
it.
much of it is perceived by the
Mhm.
parent and is not,
Mhm.
and that's not to say your reality is not valid. It is, because you are feeling a way about your postpartum experience, but you're not damaging your child in some way. I
Right.
think
You're
that piece is really
continuing to
important.
attend to the
Yes.
child, to the pregnancy, different circumstances,
Yes.
but yes, absolutely. Absolutely.
And so
I
that
love
is real.
that.
And then the coping skills, again, for someone who is again presenting with anxiety, who is
Sure.
presenting with this hypervigilance, the coping skills around that. What are we doing to help ground? What are we doing to interrupt that cycle of intrusive thoughts, rumination, all of those things that we already do? And speaking to the traumatic experience and how that can make us hypervigilant after, right? The other shoe is going to drop. We all know, we all feel like the other shoe is going to drop because it did.
Right.
That's what people like, it literally did. You walked into the hospital expecting to go home and be a beautiful little family,
Right.
and this was just going to be your birth experience, and your whole world was turned upside down.
Yeah. I know
So,
that we're
when's
we're
the
really
next
kind of
time?
out of town, like
I
out
know.
of time. But
I know
like,
I'm the
let me ask you
worst.
one question. I love. You're not the worst. You're the best. That's why I could talk to you, continue and continue and continue. But I'm wondering also, did you have an experience? And we can wrap up with this. But did you have any experiences of feeling like I can do anything now? Like now that I have survived the worst, and therefore anything that comes my way, I'm going to be fine with it. Or did you persist with that feeling of anything can happen, and if the worst happened once, it can happen again, and like that hyper awareness of all threats in the world? Where did you end up?
That is such an important question. I love the way you phrased this. I would say that I had a lot of health anxiety in the beginning. Like, oh, I just like drop dead. Like, when is the next time that's going to happen? And I still have some health anxiety. Medication really helped with that in the beginning.
Mhm.
Um, I have totally turned into the like, well, I'm here. Like, I have a great example. So I think with treatment and time, I have turned much more into the like, I can do anything. And when I start to think, I had a presentation for a group of nurses and at a hospital, and I was like really nervous, like so anxious. And I kid you not, for I was sitting up at the front, like wait, like they were all like filtering in from like other conference things, and I was doing like a keynote, and I was like sitting there like just vibrating with nervousness. And I literally said to myself, I mean, you should be dead, so whatever you say is pretty great. And it totally worked. It like
Amazing.
calmed my
Amazing.
nerves. So I feel like
Right.
that's just a great example of
It
what
is.
you are speaking to. I do use
Oh,
that sometimes.
that's so great. I think this is so helpful. I feel like we need more of these, therapeutic intervention conversations, more about supporting
Yes.
the survivors and their families and extended families. There's so much to continue to talk about. But for today, thank you so much for being a part in this conversation, for giving of your wisdom and guidance. And I know it helps people.
Thank you so much for having me. Yes, I feel like we didn't even get into the interventions and things because we just kept talking, but
Okay, we'll
maybe
do
there will be
part
will
three.
be I have
We'll
so
be
much to
back.
say on treating trauma and I didn't even get to it, but it's fine.
It's time for
Yes.
you to start putting together some trainings, because I think that you
I
have
know.
something extraordinary to offer.
You're so sweet.
Extraordinary.
Thank you so
So
much.
thank you.